Hello and welcome. Good afternoon. This is Elizabeth Hardig with the American Planning Association. It is just about 12 o'clock and I see a couple of folks are still entering the webinar room, so I will just go through some housekeeping items before we dive into our call today. For those of you who are new to our Plan for Health calls, we did share this opportunity with our Healthy Communities Interest Group. We will post a recording of the call on the Plan for Health website. And just in case you have not memorized our URL, I'm going to go ahead and chat it to you in the box right there. And it looks like Brian is wanting us to confirm the conference call line, and I will go ahead and do that. So you're welcome to listen in through your computer speakers or through our conference call line. In 1 second here, I will chat that as well. So we do have a short presentation to kick things off this afternoon and talking about the intersection of planning and public health and the intersection of physical activity and nutrition. And of course, you're welcome to submit any questions in this chat box or go ahead and unmute your lines and talk directly with our presenter this afternoon. Either way would be fine. And so there's the conference call line in the chat box on the right-hand side of your screen with the passcode. And it is a lengthy code there. We'll give folks a minute to dial in. We also have a file for you to download if you're interested, and we'll talk a little bit about that during the presentation, but it's a toolkit from one of our Plan for Health projects in Cohort 1, which is a fabulous summary of research done in Austin, Texas. All right. So we'll go ahead and get started, and let me introduce our speaker this afternoon. Marisa Jones serves as the Nutrition and Physical Activity Project Manager for the Safe Routes to School National Partnership. In this role, she supports communities to achieve policy wins that create safe opportunities for physical activity and increase access to nutritious foods at affordable prices, which is exactly Plan for Health, so that's fabulous. And thank you so much for being with us this afternoon, Marisa, and I will turn things over to you.
Thank you, Elizabeth. Thanks so much for having me, and hi, everyone. Good morning or good afternoon, depending on where you are in the country. So as Elizabeth mentioned, I'm a project manager at the Safe Routes to School National Partnership, and we are an active transportation organization focused on moving kids and people throughout their communities safely. We really grew out of the Safe Routes to School movement about 10 years ago, really focused on supporting kids to walk and bicycle to and from school safely, but quickly realized that what's good for kids is good for communities. And so we now we still do Safe Routes to School work. Definitely that's a big part of our work, but we also look at more broad community interventions. And one of the things that we know as active transportation advocates and planners is that the hallmark of a strong transportation system is one that connects people and destinations. And so my role at the National Partnership is really looking at how how people get to and from the places where they want to buy or obtain nutritious foods. So, we want to spend the bulk of today's call having a dialogue and conversation. So I'm just going to give a brief overview of the concept of safe routes to healthy food. And I know that many of you are working in place-based coalitions to advance healthy eating and active living. So I'm operating under the assumption that you know the main barriers and health implications of food access challenges, and the same with physical activity and active transportation. And if I'm operating under a false assumption, please let me know in the chat box or speak up now, and I can give a little bit more of a background. But I wanted to just kind of dive in with what we're talking about with safe routes to healthy food. So when we talk to food access advocates, often one of the biggest barriers to food access is that there isn't healthy food close by. And when we talk to transportation advocates, or I am a transportation advocate, one of the greatest barriers to transportation is safe infrastructure to get people, especially those without vehicle access, where they need to go, like school, like work, or the grocery store. But there are also places that these two challenges intersect, and I think that we don't talk about them enough. So this map shows the relationship between food access and transportation challenges. It's showing census tract where over 100 households lack vehicle access and live over a half-mile away from the closest grocery store. And there are definitely other communities that face different transportation barriers or different food access barriers. This is one of the only maps of USDA data I've been able to find that shows this relationship between not having a car and living far from somewhere that you can get food. So the challenge is that everybody needs to eat. So if you don't have a grocery store in your neighborhood and you don't have a car, you still need to get to the grocery store or the food pantry or wherever it is that you're getting food. So without a car, you're forced to leave, or without a grocery store nearby, you're forced to leave your neighborhood. And without a car, that can mean a long walk without sidewalks, a bike ride alongside speeding traffic, or a bus ride with inconvenient schedules or transfers. And for elderly people and families with small children, the challenge can be even more acute. And so what we're talking about here are the places where food access challenges and active transportation challenges overlap. And this work of overcoming the transportation challenges to healthy food access, we are calling Safe Routes to Healthy Food. So it's really about looking where these inequities in healthy food access and active transportation overlap, and then crafting solutions that take a holistic approach to solving them. And so what we've seen throughout this Healthy Communities movement is that often there are groups working in the same geography. They're working in the same city, but they tend to kind of self-segregate into like, oh, we're working on the food access challenges, and we're working on the transportation challenges. But often these challenges are intertwined. And so Safe Routes to Healthy Food is predicated on the idea that if the challenges are intertwined, the solution should be too. So I want to share a couple of examples of Safe Routes to Healthy Food, which tend to fall into two categories. So the first category are broad efforts that are undertaken at a systems level. And then the second category is specific efforts that are aimed at identifying a very specific place-based challenge. So I'll start with a couple of examples of the broad efforts. So this is an image from the Siler City, North Carolina Pedestrian Master Plan. In 2013, Siler City underwent a pedestrian master planning process, which some of you may have participated in before in your communities. One of the really unique things about this master plan is that they took food access into account, and they made recommendations to improve walkable access to grocery stores. But that's not it. They also analyzed the nutrition environment of different food venues in the town, and then prioritized the sidewalk improvements, the multi-use greenways, the side paths that created connections between residential neighborhoods and healthy food venues, or places that sell or serve healthy food. So if you go and look at this master plan, you can see a map of all the places that serve and sell food. And then you can see their scores based on how healthy the food is that's served there. And then you can see in the recommendations that they are just prioritizing making those sidewalk connections to the places that serve and sell healthy food. Another example is in Nashville, Tennessee, where the MPO, the Metropolitan Planning Organization's 25-year regional transportation plan, includes a staff analysis of how the roadways in the Nashville area can better connect residents to food retailers. And then that analysis was overlaid with maps that identified neighborhoods with lower income, communities of color, and elderly residents who would benefit the most from transportation links to food retailers that didn't require owning a car. And then the MPO included the analysis of food environments and community populations in the ranking and funding of transportation projects as one part of a very comprehensive approach to promote health and wellness of residents in the Nashville area. Another example is from one of your peers. As Elizabeth mentioned, this is a Plan4Health grantee from Austin, Texas, from Cohort 1. And as part of this report, so they, different than the first two examples that are adopted plans for regions or cities, this is recommendations, but I still wanted to share it because I thought, you know, these are your peers, they're doing very similar work to you. So in this in this document, they came up with 3 different recommendations that would really promote safe routes to healthy food. So one of them is requiring a food impact analysis for all new transportation projects. Another one is improving and maintaining transportation infrastructure around food venues. And then another one is expanding senior transportation programs to enable them to connect to the places that they need to go, including food locations. So I talked about how there are the broad approaches and then there are specific approaches. So those were some of the broad, more systems level approaches. And then here are some examples of very specific safe routes to healthy food. So this is in South Dakota on the Rosebud Indian Reservation. They were a local foods, local places EPA grantee. And that's how I connected with this group. And so the Economic Development Corporation for the tribe has a community food sovereignty initiative that has undertaken a community visioning exercise for a parcel of land adjacent to a major residential area of the reservation. So you can see, like, on the middle, you can see where a lot of people live, and then over here is where they are developing this site. And you can see there's a grocery store here that's tribally owned and operated, and then there's also a community garden and a farmer's market. But there's no connection between these places except for a highway. And with really low rates of vehicle access, people are walking to these food assets. So the food assets are there, but the transportation link is missing. And so they undertook a community visioning exercise and really identified that they wanted to create a multimodal trail for people to be able to access these food venues. And it also would create safe places for people to walk and run and ride horses and ride bicycles. I'm going to skip this one. So here's another example. So this is in Oregon. The Plaid Pantry convenience store chain really wanted to expand its business reach beyond just people in cars. So they provide ample bike parking in visible locations to signal that they're accommodating to people on bikes. And then they go beyond just providing bike parking, which a lot of businesses do, by offering a number of things that appeal to people on bikes, including an air pump, bike repair tools, flat repair kits. And then they have changed some of the foods and beverages that are sold in their convenience store to be healthier options to appeal to people on bikes. So I just want to share that this work has really been underway for years. You know, as I mentioned at the beginning, like in transportation, we've always been concerned with connecting people to the places that they need to go. And from the food access perspective, getting to the grocery store, getting to the food pantry, or getting to a community garden has always been a challenge. And we work in partnership on this Safe Routes to Healthy Food work with the Food Trust based in Philadelphia, which is where I'm also based. And they have been really leading this food access work through this Fresh Food Financing Initiative in Pennsylvania since the early 2000s. And from their very first task force meeting, where they pulled together stakeholders, they recognized that, oh, transportation needs to be a part of this. So we're not introducing a new idea. This work has really come up organically as a challenge all across communities. We've just pulled together this concept to name it and to begin to identify some solutions for different sectors and stakeholders. We do some of this work through the Voices for Healthy Kids initiative, which funds a task force of experts in food access and active transportation to come together and identify some solutions. And so we are putting out different fact sheets and resources that make recommendations for how public transit agencies and local governments can begin to advance safe routes to healthy food. And we have a fact sheet on our website, and we recently did a full-hour webinar on this, which I can share those links through Elizabeth. So I have a number of ways that people can begin to advance safe routes to healthy food, but I think these are probably things that you're already doing. So perhaps it would just be best for us to open this up for questions, if that works. I don't know if folks have, yeah, happy to take any questions that people have.
Thank you. That would be great, and I really like how you used the word intertwined. I think that that's a great way to describe both the challenges and opportunities for much of this work. And certainly in APA's comp plan guide, we think about interwoven equity and interweaving different strategies, and I think that's a perfect way to describe this. And in some ways, I think that kind of the silos, or I think you used the phrase self-segregation between physical activity and nutrition strategies, is another example of how we're trying to bring together, break down those walls, bring together planners and public health folks, bring together the two focus areas, and really think about holistic and comprehensive solutions. So thank you. This was a great introduction and overview.
Thanks. And Elizabeth, I will just give a shout out in general to the field of planning, at least in terms of the broad safe routes to healthy food strategies that were really looking at these comprehensive planning and visioning documents. Those were planners who were pulling this together, integrating public health strategies and goals and ideals into these long-range plans.
Great, great. And one of our folks from the first cohort, the Trenton team, they worked on a health and food system element, and really were thinking about not only transportation but access to healthy food and a lot of that work. So yes, definitely kudos to Plan4Healthers and planners everywhere. It's been wonderful to advance this work. So folks, please feel free to use the chat box if you have any questions that come to mind, or unmute your lines and chat with Marisa directly. And certainly we'd love to hear from you all. I can see the participants behind the scenes, so I know that a lot of you are working on these strategies and are really thinking about the intersection of both nutrition and physical activity, and we'd certainly love to hear your ideas and what you've been up to. And I do like the frame of having these kind of broader strategies versus the more specific ones. And as you were describing some of the examples, another Cohort 1 coalition came to mind, the folks in northern Kentucky, Kenton County. At the very beginning of their corner store program, they were thinking about how to really target particular stores and make sure that they were reaching the most vulnerable populations and really keeping equity in mind. And they partnered with their local transportation folks. Their acronym is TANK, the Transportation Authority of Northern Kentucky, which I think is a great acronym, and really kind of mapped on the bus routes and GIS layers to think about what would make the most sense for the community. And of course, they also engaged lots of stakeholders in that conversation as well. But it was fun to see them really work through that process and take advantage of those planning skills.
Yeah, that's terrific. That's definitely one of those things that oftentimes we see these maps of food deserts or food venues, and then we see maps of sidewalk gaps or transit gaps, but overlaying those can tell us a totally different story and lead us to strategies that we might not have thought of otherwise. And it is one of those things that once you see another community doing that or hear about it, kind of seems like a no-brainer, but the examples of safe routes to healthy food are not as broad and vast as we would like to see. So thank you for sharing that example.
Well, and I really like that we're naming the framework, and I think that's such a helpful step as well. And I'm just reminiscing about Cohort 1 again. One of our team in Nashua, New Hampshire, they were using traffic stress analysis to think about connections for their Complete Streets work, but that was very, just looking at, was it the Nashville folks, or it might have been the example before, really identifying those connections around the healthy food options too. So again, taking the framework that we already have and just, shifting it over a little bit is really great.
So maybe if we're not hearing too many questions, I would love to ask a question, but please ask questions. But I'm curious, with the work that you all are doing in your cohort, either to advance healthy eating or active living, is this generating any thoughts or ideas about how you could begin to partner with the other sector, or ways that you are starting to or already partnering? Are any of you doing safe routes to healthy food work?
I do see a gentleman on the line, and John, you're welcome to jump in. I'm going to get send a kudo to you. The folks in Lynn County, Iowa, definitely were thinking about that intersection and developed a really great interactive map that layered on access to food pantries as well as transportation, and thinking about how they could make some connections with the local city planning, which was fabulous. And I certainly hope other folks think about that as well. And feel free to add to that, John. That was a quick overview, and I know that that work was comprehensive and took quite a bit of time. But it does look like Chad has a question for us. So are you aware of some policy revisions that support slowing of traffic for walkers or bikers where there isn't established complete streets?
Yeah, so I guess a clarifying question. Are you talking about like the use of traffic calming devices or strategies even when a complete streets policy hasn't been passed?
And certainly I can put while Chad's typing there, I can just mention that we did have the St. Louis folks in Cohort 1 did a fabulous traffic calming project. That was really the focus of their Plan4Health work, and they have a wonderful toolkit. So another resource on the website, and I'm happy to pass out to folks if you're interested in traffic calming more broadly. So Chad says yes.
Yeah. I'm sorry, go ahead.
Or increased fines for not slowing down for pedestrians.
So I'm not personally familiar with increased fines for not slowing for pedestrians, but there's a community that I worked with in my previous position, Hyattsville, Maryland, where they were not ready to adopt a complete streets policy. They had seen another local community that had adopted a complete streets policy and had questions about it. And so they really wanted to start by testing calming traffic through some movable infrastructure pieces. So it's like these big orange barriers that are plastic and they can be moved. And they wanted to get the community's feedback on was this effective? Is it really slowing traffic? Is it making it safer? It was around a school. So is it really making it safer for kids rather than starting with a policy where they felt that the community might perceive that as it being imposed upon them? So there definitely are examples of traffic calming strategies that occur without a complete streets policy being present. And I can share with Elizabeth that example from Hyattsville. And I know I have seen some information on that St. Louis project too from Plan4Health, which is another great example of that.
Great, and I like that idea, Chad, of maybe an intermediary step there if we're not able to implement an ordinance just yet, thinking about some smaller ways to just slow down our streets, slow down traffic, and make it easier to get around for folks. That's great. I do see a couple of communities on the line who fall into our capacity building track. So within Plan4Health, we have, with Cohort 2, we have two options, folks who identified as implementation ready and other communities who identified as capacity building. So really have spent the project period pulling together some stakeholders, identifying and visioning around the coalition itself, and working on community needs and readiness assessments. And I just wondered, Marisa, if you had any recommendations. They're just, some of these communities are just moving to identify their PSE improvements that will happen toward the end of Plan4Health and beyond, of course. But I think that we do tend to kind of categorize still with nutrition and physical activity, and if folks are working with a new coalition or even maybe thinking of some new stakeholders to bring to the table to facilitate some of this talk at the intersection, are there any groups that maybe we kind of just forget about in our usual coalition building process, or other folks that you've seen really bring value to the conversation that maybe aren't always top of mind?
Yeah, absolutely. So three that come to mind. So first, I think the absolute most important stakeholders to involve are the community themselves. Making sure you understand from a local perspective or the on-the-ground perspective what the actual challenges to healthy eating and active living are. I know I mentioned earlier using excuse me, data and maps can be a great way to start seeing the problem, but then we need to ground truth that. We need to hear from the community what the actual challenges are. And yes, so that's the first thing. The second group that I would highly recommend that you involve in your coalitions or when you're starting to think about safe routes to healthy food or just food access in general are business owners. So here in Pennsylvania or in Philadelphia where I live, we have a great example of a grocer who participated in the original fresh food financing initiative work here in the state of Pennsylvania. And as part of the fresh food financing recommendation, transportation came out as a specifically named need for increasing food access. And so this grocer was able to take advantage of the fresh food financing initiative funds to overcome the extraordinary costs of starting a grocery store in an under-resourced area, but recognize that it was imperative for the business success of his grocery store for people to be able to get there. So he proactively reached out to our transit agency here in Philadelphia, Southeastern Pennsylvania Transportation Authority, SEPTA, to work with them to expand 2 bus lines to reach the grocery store. And this was a neighborhood that had been without a grocery store for over 20 years. And so that opened in August 2013, and now there are 2 bus routes, or from when it opened, there are 2 bus routes that didn't used to connect to the grocery store that now do. And they've coordinated together so well that the buses go into the grocery store parking lot. The parking lot was developed such that it had a low enough clearance for the buses to get in, and they come at 15-minute intervals during periods of peak shopping. I just say we want to make sure that these regulations, that these recommendations that we're making to improve safe routes to healthy food really have business interests in mind, and that they're not posing onerous regulations on businesses. And then another group that I would recommend that you involve, and this is both for urban areas and rural areas, are transit agencies. Transit agencies are an important part of active transportation because they typically involve people walking to or from a stop, and they just really help with independence and mobility and people getting around. And so transit agencies often are planning for moving people for commute and just getting them to think about the other places that people need to go. And what we, in our experience, transit agencies have been very receptive to this in both rural and urban areas and are really leading a lot of this safe routes to healthy food work. And we actually have a forthcoming fact sheet and resource guide on how to engage transit agencies in improving healthy food access. So you can keep an eye out for that in the coming, probably early in 2017.
That's fabulous. That's great. A nice preview of 2017. Hard to believe it's almost here. Mm-hmm. And great recommendations when we're thinking about engaging local businesses and transit agencies. And certainly we know we often have to make the economic argument and frame our work in terms of return on investment. And certainly this is another space where we can really tap into the local chamber or business owners, individual business owners. And what a success story to have 2 bus lines.
And on a smaller scale, the community that I skipped over earlier, Palmer, Alaska, it's a small town an hour north of Anchorage, and they have community members who are saying, we want to bike downtown. Mm-hmm. They have a great little compact downtown, but there's no bike parking. And so this is a small enough town that advocates and groups can go to these businesses and say, like, we want you to put in a bicycle rack. This would help us come and patronize your restaurant or your hardware store. And so I think this is like the SEPTA and ShopRite examples. Like we live in a big city here in Philadelphia, but there are ways to do this in small towns too.
Mm-hmm. Mm-hmm. That's a great point. That's a great point. And we have found in our second cohort we've engaged quite a few more rural communities, which has been wonderful for us. I think we were a little urban-centric with Cohort 1 of Plan4Health, and so certainly remembering that all of these frameworks can be adopted and translate to the rural setting. We do have a note from John, who's referencing the Marion Project, so the Lynn County, Iowa folks in Cohort 1 And John mentions that they used community members to identify the places they go and then looked at identifying the routes for those residents to travel safely to get to those places. The big picture was easy to identify, however, the last few steps or yards were often the highest stressed areas for the pedestrians. That is often the case, isn't it? For that last mile or the last little bit of a journey can make, to have that gap, to have that broken connection can be so frustrating for folks, and certainly negatively impacts the experience. Thanks for sharing that, John, and thank you for all your work on bringing together the nutrition and physical activity focus areas in Iowa. And I can certainly, if folks are interested in seeing the map that the team made, we'll go ahead and chat my email address. I'm happy to send that out. And of course, if you have any other questions about the presentation, I'm happy to share those as well. Oh, and John also comments that city planners could include the pedestrian point of view when doing site plan reviews. Yes, excellent point. I think that would be fabulous. Great. Well, it is just about 12:30, so our call is officially wrapping up. But thank you so much, Marisa, for sharing your resources and insights this afternoon. It's been really fabulous to have you on the line. And thank you, everyone, for joining us. And we will talk with you all soon.
Thanks for having me, Elizabeth.